Ladies and gentlemen, please welcome Sir Michael Marmot.
I have a simple proposition based on evidence that the health of a society tells us a great deal about how well that society is functioning. If health's improving, it means society is improving. If health inequalities are increasing, it means inequalities in society are increasing. And the opening line of my book, The Health Gap, was why treat people and send them back to the conditions that made them sick. Particularly in Britain, right now, there's a great deal of angst, rightly so, about the health care system. An NHS that's broken needs to be fixed. And that's right, but that's not my concern. In fact, a majority of the inequalities in health that we see are not related to inequalities in access to quality care. They're related to inequalities in society. So it's not the health care system that I'm going to talk about. It's health in the population, the conditions that make people sick. As you heard in the introduction, I chaired the World Health Organization Commission on Social Determinants of Health. We launched it in Santiago de Chile in 2005. We said we would produce our final report in 2008. And the Director General of WHO, in launching the commission, said it will report 60 years after the founding of the World Health Organization in 1948 and the Universal Declaration of Human Rights, 30 years after the Alma Ata Declaration. WHO convened a big meeting in Alma Ata, declared health for all by the year 2000. We missed that goal, didn't we? As one WHO official said, malaria for all by the year 2000 might have been easier to achieve. And he said, when the Commission on Social Determinants of Health reports, we'll be looking for a declaration of similar ringing clarity about how we will take action to achieve equity in health. And I said when we launched the report, somewhat naively perhaps, that we wanted to foster a social movement for health equity through action on the social determinants of health. I say somewhat naively because I wasn't entirely clear what a social movement was, let alone how you foster one. But I actually think we've done it. We do have a social movement, and I'll give you some of the evidence. It doesn't mean everything's going swimmingly. You may have noticed there was an election. Yes, they got the results this morning. Things are about to go even less swimmingly in a country where, as I'll show you, things were going pretty badly. In fact, that may be part of the explanation. On the cover of the report of the Commission on Social Determinants of Health, which we called Closing the Gap in a Generation, we said social injustice is killing people on a grand scale. Bit unusual for a WHO report, but that phrase, social injustice is killing on a grand scale, had some resonance. We nailed our colours to the mast. In fact, one country said about this report, it was ideology with evidence. I quite like that. We do have an ideology. Health inequalities that are judged to be remediable and are not remedied are unfair, unjust. Putting them right is a matter of social justice. But the evidence really matters. Because you have good intentions, it doesn't mean what you do is going to have a good result. The evidence really matters. in the wake of the WHO Commission, it was a global commission, when Gordon Brown was Prime Minister, the government of the day invited me to conduct a strategic review of health inequalities in England to answer the question, how could we apply the findings and recommendations of the Global Commission to one country, England? And that led to Fair Society, Healthy Lives, the Marmot Review, and as you heard, on the 10th anniversary of publication of the Marmot Review, we published Health Equity in England, the Marmot Review 10 years on. And we had initially 6 domains of recommendations. Give every child the best start in life, education and lifelong learning, employment and working conditions. Number 4, wow, really radical. People should have enough money to live. They should be able to feed themselves, have shelter, luxuries like clothes. Number 5, healthy and sustainable places in which to live and work. And number 6, taking a social determinants approach to prevention. In the light of COVID, we added number 7, tackle racism, discrimination, and their outcomes. And number 8 should have been there all along. Pursue environmental sustainability and health equity together. What happened after my 2010 publication? Well, this is what happened. If we look at life expectancy at birth, I've started this at 1999. I could have started it at 1929. Life expectancy was improving for women and for men about 1 year every 4 years. Wow, 6 hours every 24 hours means you got the first 6 hours today for nothing. In fact, if you learned something, you may have even had longer life expectancy at the end of the 6 hours than at the beginning. Wow, that's what was going on. And that went on for a century. And then in 2010, 11, it came to a grinding halt. The rate of improvement slowed dramatically. And in the first 2 years of the pandemic, it fell. So just think about this. For a century, life expectancy had been improving 1 year every 4 years. And in a 14-year period from 2010 to 23, life expectancy didn't improve at all. I cannot think of another period in peacetime in the United Kingdom where life expectancy did not improve in a 14-year period. What happened in 2010? You may remember a new government was elected. You could say, well, you published your report. It was your report that did it. Well, no, I don't think my report did it. A new government was elected. And what did that government have as its number 1 priority? Shrinking the state, austerity, cutting back on public expenditure. I'll come back to that. But this is pretty dramatic. And remember what I said at the beginning, that if health's not improving, society's not improving. And if inequalities are increasing, inequalities in society are increasing. This is life expectancy at birth by deprivation decile. So classify people by where they live, classify where they live by level of deprivation, and the more deprived the area, the shorter the life expectancy. I'm showing you women here, but it's similar for men. The top graph, the lighter green, is London, and the darker green is the northeast. For the least deprived, the difference in life expectancy between London and the northeast is tiny. If you're rich, it doesn't much matter where you live in the country. Your health's pretty good. The greater the deprivation, the bigger the disadvantage of living in the northeast compared to London. You can see as we go down, the gap between London and the northeast gets bigger. Or saying it the other way, the gradient is steeper in the northeast than it is in London. The consequence, and this is one national measure of multiple deprivation, the consequences of deprivation for your health are bigger in the northeast than they are in London. Now look at what happened between 2010-12 and 2016-18. Look at London. The dotted line is the earlier period. The solid line is the later period. At each level of deprivation, life expectancy improved a bit in London. In the northeast, life expectancy fell in the most deprived in the northeast. Didn't improve in the next decile, or the next, or the next, or the next. In fact, it didn't improve in the bottom 60% of the population. It either went down or didn't improve. So this is where we were pre-pandemic. Life expectancy had stopped improving, inequalities were getting bigger, and life expectancy for the poorest people was falling. They were getting sicker. If my initial proposition is correct, it means social conditions for the poorest people were getting worse. So what we had was a decade of austerity, a decade plus of austerity. And the government was true to its word. They said they wanted to cut public sector expenditure. In 2009-10, public sector expenditure was 42% of gross domestic product. That went down year on year. By 2019, that 42% had become 35%. 7% of GDP a year cut out of public expenditure. If our GDP is about 2.7 trillion pounds a year at today's prices, 7%, somebody will do the sums, 180 billion pounds. 180 billion pounds a year taken out of public sector expenditure. So when I maintain the fiction that I'm not party political, I just look at the evidence. But when the new Chancellor said £20 billion black hole, I thought, there's a £180 billion black hole. It's not a £20 billion. The fact that she felt the need to put up taxes, well, of course, we're a low-tax country. We're a low-tax country. It's suggested that after she'd finished putting up taxes, we'll go up to about 38% of GDP taxation. The EU14 is 40% of GDP, but that'll rise too. France, 48%, Finland, 50%. We're not a high-tax country. The US is less, and I'll show you they're not getting much benefit for that. And then in 2019-20, with the pandemic, 2020, the Chancellor said, whatever it takes, and increase public sector expenditure. Come on, you can remember who the Chancellor was, can't you? I know it's a bit tricky. Between the Brexit referendum and 2023, we had 7 Chancellors, 5 Prime Ministers, 7 Secretaries of State for Health, 10 Housing Ministers. Utter chaos! Utter chaos! Between the Brexit referendum and 2023, utter chaos. Nobody was functioning in government. They weren't doing anything. Well, the Chancellor, so I'll give you a clue, he became the 5th of those 5 Prime Ministers, Rishi Sunak, said whatever it takes and increase public sector expenditure in the face of the economic crisis caused by the pandemic. And I thought, hang on a minute, When we had the economic crisis caused by the global financial crisis, the Chancellor didn't say, whatever it takes. He said, we're living beyond our means. This is immoral. We've got to cut public expenditure. Oh, you mean it wasn't a moral necessity? It wasn't an economic imperative. It was a political choice. And that political choice in 2010 did great damage. If we look at child poverty rates, child poverty defined as living in a household at less than 60% median income. For OECD, the rich countries, Colombia, US, Italy, UK. US is right up there. It could be Denmark, Norway, Germany. It doesn't have to be as high as it is. And if we look at what happened between 2012 and 2021, the UK had the fastest increase in child poverty out of 38 countries, 38 rich countries. As a result of government policy, child poverty went up. Guess what the evidence shows? That a child growing up in poverty does not develop as well, has worse health, and the subsequent life course is affected adversely. I heard a podcast last year, George Osborne, the first of those chancellors before the seven, well, the last before the subsequent six, said the economic policies we pursued after 2010 meant we actually had the strongest growth in the G7. More jobs were created. A lot to be proud of. Britain in 2016 was buzzing. People were looking at the UK and saying, that's the example we want to follow. And I thought, where was I? I thought I was here in 2016. What did the numbers show? Look at the UK real wages, the blue line there, with comparison peer countries. We had the steepest fall in real wages. Look at 2016, when we were buzzing and other countries were looking at us and saying, that's the example we want to follow. What? They were looking at us and saying, we'd like people to be paid less, working people. People not, as he said, strivers and shirkers. No, people in work paid less. On the left-hand side, you can see what was happening in the previous Conservative government, then under Labour, and then under the Conservative-led coalition and Conservative government. We were not buzzing. And the program, by the way, these data come from that radical journal, the Financial Times, the FT. If you look at total government spending as a percent of GDP, it was coming down at the end of the Thatcher Major period, went up quite sharply under Labour, came down dramatically under the Conservatives. Spending on healthcare came down. It went up. In fact, if you adjust, you know when you heard politicians say, we're spending more on healthcare than ever before in our history. Yeah, it's true. We got more people than we ever had before in our history. If you adjust for the size of the population and the age of the population, guess what? They get sick more. And you need to spend more on healthcare if you've got an older population. If you adjust for the size and the age of the population, healthcare expenditure under Margaret Thatcher and John Major went up at about 2% a year in real terms. In the Labour government, it went up 5.8% a year. And in the Conservative-led coalition and Conservative government, it went down 0.07% a year. So when they said, we're spending more than ever before in our history, it's one of those partially true statements that's designed to mislead. We're spending less per person than ever before in our history, but we'll try and cover up that fact. And did it make a difference? I said I don't want to talk about healthcare, but yeah, it did. If you say the number of people waiting for care in January 2009 was 100. In 1997, it was 230. That expenditure that Labour did, of increasing by 5.8% a year, brought the number of people waiting for care down dramatically. And then the government changed 2010. By 2019, it was back up at 190. So January 2009 was 100. It had nearly doubled. And that was before the pandemic, before the war in Ukraine, before the inflation. All of those explanations trotted out by government ministers. I'm not anti a particular political party. I'm anti-fibbing. You know, if we want to solve some of the problems, tell the truth about the problems that we face. Share of A&E attendees seen within 4 hours came down. Earlier this year, we published a report that I'd wanted to do for a long time. People like me are always citing the poor health for the poor compared to the rich. And I do it all the time. In the area next to Grenfell, the Grenfell Tower, the life expectancy for men was 16 years shorter than in the rich part of the Royal Borough of Kensington and Chelsea. Gap between the poor and the rich. And I said, instead of focusing on the poor, let's focus on the rich. And I don't mean thinking about water skiing accidents while you're on holiday in the Barbados or whatever. No, I mean focusing on the least deprived shows us what's possible in terms of good health. What if everybody had the low life expectancy, had the low mortality of the least deprived? Well, as health follows a gradient, what you see, the greater the deprivation, the larger the number of excess deaths, excess being defined as the higher number that you get because you're not in the least deprived 10%. And over the 10 years from 11 years, from 2009 to 2020, there would have been 1 million excess deaths linked to deprivation. Now, there was a social gradient pre-2009, so there are always excess deaths linked to deprivation. But as I showed you at the beginning, the gradient got steeper. And we calculated that of that 1 million excess deaths, 148,000 in excess of what we would have predicted based on the previous decade. Arguably, austerity killed 148,000 people. We've been concerned about funding for local government. And we published this earlier this year. We plotted life expectancy for every local authority in the country in 2010-12. And on the y-axis, the change in government funding per head by 2019-20. What you see there is the shorter the life expectancy of a local authority in 2010-12, the steeper the subsequent reduction in local government spending. I look at this and think, the kindest explanation I can give for this is absent-mindedness. They didn't know what they were doing. But it looks pretty systematic, doesn't it? In what moral universe could it be the right thing to do the sicker the community, the more money you take away. And they might have argued, no, we didn't mean to take it away from sick communities. We just meant to take it away from deprived communities. The greater the deprivation, the steeper the reduction. Yeah, but have you looked at any of the numbers we've been producing? There's a close link between deprivation and health. So what you were doing as government policy, by declaring war on local government, but doing it in a regressive way, the sicker the community, the more money you were taking away. Could this be part of the explanation of why life expectancy stopped improving, why inequalities got bigger, why health declined for the poorest people? Yeah, I think it could. I implied when I was talking about my 6, now 8 recommendations, number 4 was everybody should have at least the minimum income necessary for healthy life. And you might say, in a rich country like Britain, that should be pretty easy to achieve. Are we a rich country? Again, forgive me, this is from the Financial Times. If you look at Switzerland, the grey bar, and Norway, the green, and the US is the dark blue, and the UK is the red. So look at the 90th centile of income, so people 10% from the top. In the UK, we have about the same income at the 90th centile as they do in Norway, a bit less than in the US or Switzerland. So our rich people are as rich Norwegians, not quite as rich as the rich Swiss or Americans. Slovenia, quite a bit poorer. Now look at the 50th centile, people in the middle. People in the middle in Norway are doing better than we are. In fact, they're doing as well, if not better, than the Americans, nearly up to the Swiss level. Slovenia is catching up to us. Now look at the 10th centile. Norway's right up there. And we are way down, actually below Slovenia. We're not a rich country. We're a poor country with a few rich people. And so is the US. And what it's likely that that election was about is increasing that, making the US a country where oligarchs can thrive and the rest of the people can suffer. And by golly, as I'll show you, they have been suffering. So if we look at COVID, first a decade of austerity, then the challenge of COVID. What we've got here, again, is deprivation and all-cause mortality. And these lower bars, the blue, is COVID mortality. We said in my COVID report that the pandemic would reveal the underlying inequalities in society and amplify them. And so it proved. The social gradient in COVID mortality is almost identical to the social gradient in all-cause mortality. Slightly steeper for COVID because of living in overcrowded accommodation, working in frontline occupations. But it means to deal with the pandemic, yes, we needed vaccines. Yes, we needed social distancing. But we need to deal with inequalities, which relates to what we were talking about a few moments ago. We just convinced the G20 health ministers to recognize that to prepare for pandemics, you have to address the social determinants of health. And I said that it would amplify the inequalities. This is life expectancy for men and women for the 3 years 2018 to 20, very much influenced by the pandemic. the first year, compared with the previous 3 years. And you can see that the greater the deprivation, the steeper the reduction. For men, it didn't improve at all. For women, it did improve life expectancy for the top 60%. But in general, the greater the deprivation, the bigger the reduction in life expectancy. The pandemic increased inequalities. And it's not just life expectancy, but healthy life expectancy. If you're in a more deprived area, not only do you have a shorter expectation of life, but more of those fewer years will be spent in ill health. Women in the most deprived decile can expect to spend a third of their lives in ill health. And that's been increasing. Health's been getting worse. The level of ill health has been getting worse. American colleagues did this. The change in life expectancy 2019 to 21, the red is the United States and 19 peer countries. Now 2019 is interesting because life expectancy in the US declined in 2016, declined in 2017, declined in 2018, and went up a little bit in 2019, and then declined sharply in the first 2 years of the pandemic. And Americans voted for Trump because they said everything was better while he was president. What? Health was getting worse. And the pandemic was mismanaged disastrously. And the worst was the US. And remember my original proposition, if health's getting worse, society's getting worse. And the countries that were doing badly were Scotland, Northern Ireland, Germany, and England and Wales. So we were doing pretty poorly. And in fact, there's a correlation. If you look at healthy life expectancy in the decade pre-pandemic, the less the improvement in healthy life expectancy pre-pandemic, there's the US up there, the higher the excess mortality during the pandemic. So in other words, if you have a poor health record pre-pandemic, you're likely to do poorly during the pandemic. The US was the worst, then came the UK. Not good. And that's part of my argument, that you've got to prepare for a pandemic, not simply by stockpiling vaccine, but by addressing the social determinants of health and health equity. I'm co-chairing the Global Council on Inequality, AIDS and Pandemics. I'm sitting there with Winnie Byanyima, the Executive Director of UNAIDS, and we launched it in Brazil last year. And as I mentioned, I was back in Brazil twice this year to try and get the G20 health ministers to take on board social determinants of health. And they did. If you look at examples of COVID amplifying inequalities, look at life expectancy in New York. The so-called Hispanic paradox, that Hispanics have longer life expectancy than non-Hispanic whites. African Americans, non-Hispanic blacks, have much shorter life expectancy. But then look what happened with the pandemic. Life expectancy fell much more sharply for Hispanics than it did for whites, and fell sharply for blacks. So the ethnic inequalities got bigger. And some of the evidence we've been reviewing for our Global Council, countries with higher rates of income inequality have higher rates of death of COVID-19, of AIDS deaths, and of HIV infection. Inequality is not terribly good for health. In Brazil, while white people have seen falling rates of HIV, black people face rising rates in recent years. And sticking with Brazil for a moment, looking at COVID-19, I'm sorry this is hard to read, but the dotted line is white mortality from COVID-19. The black, the blue is indigenous people. And you can see the excess mortality. Brazil, for a long time, when you'd meet Brazilians, they say, no, we have no ethnic inequalities. We're all the same. We're all Brazilians. They've dropped that pretense. They now know that black Brazilians have higher mortality than white, and indigenous people particularly high. We found huge excesses in the early phases of the pandemic for Black Caribbean, in the UK, for Black Caribbean, Black African, Pakistani, Bangladeshi, and to a lesser extent, Indian. And if you look at living in overcrowded accommodation, Black, Asian, mixed, white British, one of the reasons for the excess is living in overcrowded accommodation. In egalitarian Sweden, income gradient in the risk of being hospitalized in intensive care unit by COVID vaccination status and socioeconomic level, you can see the greater the deprivation, or the lower the income, the higher the risk. But if you're vaccinated, the lighter shade, that reduces the excess. But even among vaccinated people, it's a gradient. The lower the income, the greater the risk. So the first challenge to health inequalities was a decade plus of austerity. The second challenge was the pandemic. And the third challenge is the cost of living. In my 2020 review, we pointed to the fact that child poverty had gone up after housing costs from 27% to 30%. When senior government ministers were challenged in Parliament, why has child poverty gone up? No, they said it hasn't. Absolute poverty's gone down. We're wonderful. We care about our children, and that's why absolute poverty's gone down. I won't destroy your evening by explaining how they measured absolute poverty, but it unhinges the mind. The Joseph Rowntree Foundation measures destitution. Destitution is doing without two or more of housing, heat, light, food, clothing, and toiletries. In 2022, 1 million children were living in a state of destitution in the United Kingdom, doing without two or more of those 6 basics. And that was a 2.5-fold increase in only 5 years. When one of those spokespeople for government ministers said, oh, we've reduced absolute poverty, I said, if I were you, I'd be a bit careful about that statement. Look at the Joseph Rowntree Foundation figures on destitution. 2.5-fold increase. So 3.8 million people, 2.8 million adults, 1.0 million children. Dramatic increases in destitution. We did a report on this earlier this year that we launched in Parliament. Cold homes, fuel poverty. What causes fuel poverty? Poverty, the price of fuel, and the thermal properties of the dwelling. If you look at this, insulation, we have one of the worst in Europe. Over 50% of homes need upgrading. Income and cost of living, I showed you what's happened to real wages, and child poverty gone up, so we're in real trouble. And the cost of fuel, it's higher, 30% higher than the European average. I can't get my head around this. As a humble doctor, not an economist, economics leaves me, so perhaps somebody clever here can explain this to me. When the price of gas coming out of Russia goes up after they invade Ukraine, we pay more for wind. 2/3 of our energy comes from renewables and nuclear. But when the price of gas goes up, even though most of our gas does not come from Russia, we pay the marginal cost, not the average cost. An economist friend of mine, I bumped into him on the walk on Hampstead Heath on a Sunday morning. I said, why do we pay the marginal cost, not the average cost? Oh, give me a break. It's Sunday morning. I'm trying to relax. I said, if I go into Marks and Spencer and buy underwear, they don't charge me the marginal cost for the last pair of underpants. They charge me the average cost, surely. Oh, it's Sunday morning, I'm trying to relax. He said, I'll write to you. So he did write to me, and I still don't get it. What I do know is those energy costs make a real difference. If you're in France, down there, and you're in the top 10% of household income, you pay about 6% of your household income on home energy. If you're in the top 10% in the UK, you pay about 6% of your household income on home energy. If you're in the bottom 10% in France, you pay 10% of your household income on home energy. And if you're in the bottom 10% in the UK, you pay nearly 18%. That gap between the top 10 and the bottom 10 is bigger in the UK than in any other European country. This is not a good place to be poor. JRF and the Trussell Trust calculated the cost of essentials, like those 6 that I mentioned. And then they looked at universal credit. So that horizontal line is the cost of meeting essentials. If you're a single person or a couple, and you're on universal benefit, universal credit, you get about 70% of the cost of meeting essentials. So if you're on universal credit, we guarantee you'll get sick because we don't give you enough to live. Housing, heat, light, food, clothing, toiletries. How many times have you heard politicians, I'm not anti-politicians, how many times have you heard politicians say, oh, I could live on 30p a day, poor people are lazy, they're feckless, they're ignorant, they don't know how to budget, they don't know how to cook, I could. Look at the numbers. If you're in the bottom 20% of household income, to follow the healthy eating guidance, you'd have to spend 50% of your household income on food. It's true that if you're in the top 20%, you'd only have to spend 11% of your income on food. If you feed your children junk food, you are irresponsible. But if you're in the bottom 20%, you're not irresponsible, you're poor. Because if you were spending 40% on rent and 20% on heating, that's 60%, and 50% on food, that's 110%. And the trouble with children is they grow and you need to replace their trainers from time to time. Well, forget it. So what? Something's got to give. You become homeless. You live in a cold home. You don't eat. This is not inability to budget. It's being poor. And if we look at food insecurity from the Food Foundation, 13.6% of households experience food insecurity in June 2024. Households with children, it was more like 18%. Food insecurity is doing without food for a whole day because of inability to afford it, not eating enough to satisfy your hunger, or skipping meals. And 1 in 5 households with children experiencing food insecurity. The second most common question I get asked is, why aren't you depressed? This is why I'm not depressed. I always have an evidence-based answer. More than 40 places have declared themselves Marmot places. We've kicked off a 2-year program of work with Scotland. They say they want to become a Marmot country. And we'll work with 3 places in Scotland. Coventry was the first, declared itself a Marmot city. Andy Burnham, the Mayor of Greater Manchester, said, we'll do it in Greater Manchester. So we worked with local colleagues, Build Back Fairer in Greater Manchester, Health Equity and Dignified Lives. Cheshire and Merseyside. I was in Liverpool yesterday, hearing what they're doing, according to, quote, Marmot principles. Luton, a Marmot town, Lancashire and Cumbria, Waltham Forest, Leeds, Gwent. Wow. All of the, and they're approaching us. They're saying, hey, we want to do this, despite the steep cuts to local government. They're saying, we want to improve things for our population. My 8 principles of action through the life course. We're going to do it. And local government, healthcare, the voluntary and community sector, public services, business and the private sector. We'd quite like national government to come in behind it, which they have not been doing. And I'm arguing that they should now start doing it. Liverpool's going to launch itself as a Marmot city in 2025. We did Altogether Fairer in Cheshire and Merseyside, and Liverpool, the city of Liverpool, has picked it up and working with it. Coventry, it runs all through it. They were the first. Luton, they said it fits with their priorities. And business, what about business? Legal and General, a huge private sector corporation that has, when I last looked, 1.2 trillion pounds under investment. Not trivial. I mentioned GDP is about 2.7 trillion, so it's not tiny. And they said not just what can we, Legal and General, do, but what can business do? So we produced a report, The Business of Health Equity, the Marmot Review for Industry. And we said 3 areas in which you can be active. Paying conditions for your employees, goods and services, your clients and customers. So we're not just talking about a financial organization. I mean, if you're the tobacco industry, we can't work with you because the product you produce is harmful. If you're the food industry, you can be good for health or bad for health. You can put sugar in baby food, which is bad for health, or you can produce good quality food, good for health. And the wider impact on the community. I said this is not primarily about healthcare, but we're trying to get partners in healthcare to take action on the social determinants of health. We're working with the East London Foundation Trust, and a public health doctor working with East London Foundation Trust said, hey, we could take your report for industry and apply it, what he called the Marmot Mountains. So the East London Foundation Trust, as a good employer, thinking about service users, what do we give to our service users, the people we're there to serve, and impact on the wider community. Some of the comments, I won't go into this, but in Luton they said, being a Marmot place brings stakeholders together around health equity and is part of our journey to the Luton town-wide 2040 vision. Cheshire and Merseyside, one after the other. Nobody in the country noticed this, but when Keir Starmer was leader of the opposition, and he produced his health mission, there was a technical appendix. And in the technical appendix, I say nobody reads page 12 of the technical appendix underpinning the leader of the opposition's health mission. But I did. And it said, the next Labour government will amplify the approach of Marmot cities like Greater Manchester and Coventry by making England a Marmot country. Andrew Gwynn, who's now the Minister of Public Health, has repeated this. He said, Michael, it's real. And he said it publicly. We will make England a Marmot nation, he said. Okay? We will both help you and hold you to account. Let me finish by saying I've given you a lot of reason to be depressed. But to be truly radical is to make hope possible rather than despair convincing. Thank you.